Cytokine Release Syndrome, CRS, explained for CAR T-cell patients. Imagine a tiny army of immune cells engineered to fight leukemia. When these CAR T-cells are infused into the body, they seek out and attack cancer cells. But sometimes, this powerful response can cause a reaction called cytokine release syndrome. CRS is a widespread inflammation caused by the immune system's overreaction. It happens because the CAR T-cells rapidly multiply and releases signaling proteins called cytokines once they recognize cancer cells. These cytokines act like messengers, calling in other immune cells to help fight the disease. Key cytokines involved include interleukin-6, which plays a major role in inflammation, as well as granulocyte macrophage colony, stimulating factor and interleukin-1 beta. When these cytokines are released in large amounts, they stimulate other immune cells like monocytes and macrophages. These cells then produce even more cytokines, creating a cascade of inflammation that can spread throughout the body. This process can lead to symptoms such as fever, low blood pressure, difficulty breathing, fatigue, and sometimes more serious issues. CRS usually develops into phases. First, within the first 5 days after CAR T-cell infusion, there is local expansion of the CAR T-cells at the tumor site. Then, between days 3 and 12, cytokines and immune cells enter the bloodstream, causing systemic symptoms. The severity of CRS can vary widely. Some patients experience mild flu-like symptoms, while others may develop life-threatening complications requiring intensive medical care. Managing CRS is crucial for patient safety. Supportive care includes fluids, oxygen, and medications to stabilize blood pressure. To specifically target the inflammation, doctors often use drugs like tocilizumab, which blocks the receptor for interleukin-6. This helps reduce inflammation without stopping the CAR T-cells from fighting leukemia. In more severe cases, corticosteroids may be used to suppress immune activity further. Researchers are also exploring other ways to prevent or lessen CRS, including targeting additional cytokines or immune pathways. For patients undergoing CAR T-cell therapy for leukemia, understanding CRS is important because it is a common side effect that can sometimes become serious. Early detection and prompt treatment can make a big difference in outcomes. Patients should be closely monitored by healthcare teams experienced in managing CAR T-cell therapies. If any symptoms like fever, trouble breathing, or low blood pressure occur, they should be reported immediately. In summary, cytokine release syndrome is an immune response triggered by the activation of CAR T-cells used to treat leukemia. It involves a complex chain of cytokines and immune cells that can cause inflammation throughout the body. While it can be serious, with careful monitoring and targeted treatments, many patients recover well. Always remember to consult healthcare professionals for personalized advice and management during this therapy.